Fatty liver is quietly becoming one of the most widespread health problems in America today. And what makes it especially dangerous is how silent it is. Most people feel completely fine in the early stages. No sharp pain, no obvious warning, no moment that screams, something is wrong. But here's the truth your body hopes you notice. Your liver rarely shouts. It whispers first. And in many cases, those whispers show up somewhere you probably never thought to look. Your hands. Today we're walking through 5 early hand signs that may indicate your liver is under stress. Some linked to insulin resistance, the biggest driver of fatty liver, and others that can signal the liver is struggling to keep up with its workload. Let's start with one of the most commonly overlooked clues, and you can check it right now. Usaiker's sign number 1, persistent red palms, Palmar Erythema. Take a moment and look at your palms. Specifically, look at the fleshy areas, under your thumb and along the base of your pinky. Do they look unusually red, even when you're not hot or embarrassed? This condition is called Palmar Erythema. At first glance, it can look harmless, like your hands are just a little flushed. But when the redness sticks around, it can sometimes signal liver stress. Here's why. One of the liver's many jobs is breaking down hormones, including estrogen. When the liver becomes overloaded, especially with fat, estrogen levels can rise in the bloodstream. That hormonal shift causes tiny blood vessels in the palms to widen, giving the skin that persistent reddish appearance. Now, to be clear, this can also happen during pregnancy and in some healthy people. But if red palms appear alongside metabolic risk factors, it's worth paying closer attention. Or sign number 2, dark, velvety knuckles, Acanthosis nigricans. This next sign is one of the strongest early metabolic red flags. Look closely at your knuckles. Do you notice darker skin, a slightly thickened texture, or a velvety appearance compared to the rest of your hand? This condition is called Acanthosis nigricans, and it matters because it's strongly linked to insulin resistance, the number 1 driver behind non-alcoholic fatty liver disease. Here's the connection. When insulin levels stay chronically high, skin cells can start to grow and pigment abnormally, especially around joints like the knuckles. What makes this sign so important is timing. It often appears years before blood sugar problems are diagnosed, and many people miss it completely. If your knuckles are noticeably darker than nearby skin, your body may be waving an early metabolic warning flag. Or sign number 3, spider angiomas. This one is easy to miss unless you know what you're looking for. Check the backs of your hands and forearms. Do you see tiny red dots with thin branching lines spreading outward, almost like spider legs? These are called spider angiomas. One small spot by itself is usually harmless, but multiple spider angiomas appearing over time can sometimes reflect hormonal changes related to liver function. When the liver is working efficiently, it filters excess hormones and compounds from the blood. But when fat accumulation or inflammation slows that process, certain substances can build up, and small surface blood vessels may become more visible. If you're noticing several of these popping up, especially alongside other risk factors, it may be worth discussing with your healthcare provider. Sign number 4, white or opaque nails, Terry's nails. Your nails can quietly reveal what's happening inside your body. Look at your fingernails. Healthy nails usually show a pink nail bed with a clear, pale half-moon near the base. But in Terry's nails, most of the nail bed turns pale or opaque white, with only a thin, darker band near the tip. Why this matters? The liver produces a critical protein called albumin. When liver function declines significantly, albumin production can drop, and nail appearance may change. Important note, this sign is not an early symptom. It's more often associated with more advanced liver stress. If you notice this pattern, it's smart to bring it up with your doctor rather than self-diagnosing. Flowering sign number 5, thickened palms or finger curling, Dupuytren's contracture. Finally, take a look at the palms themselves. Do you notice thickened cords under the skin, tightening in the palm, or a ring finger or pinky that doesn't fully straighten? This condition is called Dupuytren's contracture. While it primarily affects the hand, it has strong associations with metabolic stress, diabetes, and long-term excessive alcohol use, all of which are major risk factors for liver disease. It's another example of how the body often reveals internal stress through external changes. The bigger message most people need to hear. Fatty liver rarely announces itself dramatically. It develops quietly, gradually, predictably, and the body often gives small visual clues long before serious symptoms appear. Dark knuckles may signal early insulin resistance. Red palms, spider angiomas, white nails, or thickened palms can suggest the liver is under increasing pressure. But here's the encouraging part. The liver is remarkably resilient. When caught early, fatty liver is often reversible with the right lifestyle changes and medical guidance. What to do next? If you've noticed one or more of these signs, don't panic, but don't ignore them either. Smart next steps include speaking with your doctor, checking liver enzymes, reviewing blood sugar and metabolic health, and taking a fresh look at diet, weight, and activity levels. Early awareness changes outcomes. Before you go, I'm curious. Had you ever heard that your hands could reveal liver stress? Drop a quick yes or no in the comments. And if this video helped you see your body a little more clearly, share it with someone who would want to catch problems early, not late. Subscribe for more science-backed health insights designed to keep you strong, informed, and one step ahead. Your body is always communicating. The key is knowing how to listen.